So it's my pleasure to invite my esteemed teacher and a great geriatrician in Rajasthan, Dr. Arvind Mathur, for his talk on enhancing longevity and health span.
At the outset, I thank Professor Dr. Rajiv Gupta and his team to have given this opportunity to be with all the distinguished cardiologists. I'm an internist practicing primarily for the old age persons. And when they asked me to talk about this particular subject, can we enhance longevity and health span? Then I realized that each one of us want it. And probably for all these years, we have been thinking of it and have been praying that God should give us something so that we have an increased longevity. With the public health development and even the preventive measures which we have been taking, particularly for the cardiovascular diseases, they have impacted the lifespan. And the life expectancy of our country has doubled from 1950 to present time. So this has been a great public health achievement which we have seen. Now, we all know that these measures have been due to the commonly known factors which we have been using for the cardiac prevention. Because we are going to talk about the future of CAD prevention, but I want to emphasize that these measures are very important and they have already yielded very good result for us with diet, regular exercise, stress management, adequate sleep, smoking and alcohol limitation, regular monitoring, social connectedness, that is also very important. And along with this, certain genetic issues, calorie restrictions about which we'll be talking about some subsequently also, fasting and certain anti-aging therapies or so. So these factors have already worked in past so many years. We all realized that the poor lifestyle habits have been responsible for most of our miseries. And for this particular segment of medicine has come up as a lifestyle medicine, and which advocates that we try to use these measures for prevention. And one thing which has been recommended, that the assessment of lifestyle factors should be part of a vital sign recorded during the patient visit. And remember, the visit of the patient to the doctor is the best opportunity, a window of opportunity for imparting them education about prevention. So lifestyle medicine should be integrated into the core competencies of all specialties, I would say, because this particular part has been responsible for all the ailments which we suffer these days. Now, what we saw that with the life expectancy increasing, the lifespan has increased. We have got a lot of older people in our community, but this has come with a cost that with the age, the chronic degenerative diseases, they have increased. Earlier, the infectious diseases were common, but now we have dual burden of both chronic degenerative non-communicable diseases and the infectious diseases. And in this, aging is the major responsible factor, risk factor. Earlier, it was not considered that age is a disease. Age is not disease, but it's an important risk factor which is responsible for many of them, and they have been mentioned as the comorbidities of aging. Now, with the increase in the lifespan, the healthy lifespan has not increased. We have older people who stay sick for a longer period, and there comes the issue of health span. In 1980, Fries promoted a term, compression of morbidity, wherein we wanted to defer the onset of these chronic diseases towards the end of their life, so as to reduce the burden of the disease. Thereafter, it was felt in 2009, the term of health span came, where we wanted a period of life free of major diseases in most of the time when we live. And when it comes to longevity, we wanted optimal longevity, where the goal is that we live long but well. So when you look at this diagram, we see that we extended the life, but the duration of sickness also extended. So we are looking for a compression of morbidity and increase the health span. Now, it has been found that the health span depends upon the physiological changes which occur with the aging. With the aging, we have seen that vascular dysfunction is there, which is responsible for many of the ailments. It is responsible to contribute for, besides cardiovascular diseases, to dementia. It has been responsible for other ailments also. The other aging-related changes which we notice are like peripheral insulin resistance, reduction in GFR, the impaired diastolic filling, immune dysfunction or immunosenescence, or the neuronal dysfunctions. All these things, they lead to functional deficit. Nowadays, in old age medicine, we are talking of intrinsic capacity and functional ability. The idea is that we do not talk of a particular disease. We are just trying to look at what are the capacities of that individual, and how much functional is he. So these changes, physiological changes, they cause dependence, they cause functional dependence, and they should be the target for our action. So now with this, we have realized that aging is an important risk factor. And we have realized that there are several diseases which are associated with the aging. Instead of working for a prevention of each one of them, say like we have got Parkinson's, CVA, or hypertension, stroke, Alzheimer's, etc. If we start working for prevention of each one of them and then try to work on that, instead of that, if we could work to slow the aging, that will prevent most of the ailments. So delaying the age-related disorders is important, and we have to work to slow the process of aging, for which there are several ways in which our scientists, researchers are working, and it's a real phenomenal thing which they have been doing it. So now with this, our aim as any healthcare institution has been to seek fundamental knowledge about the nature and behavior of living systems, and application of that knowledge to enhance health, lengthen life, and reduce illness and disability. So that is what we are trying to look for about the increasing the longevity and health span. For this particular thing, a biological field has come up as a geroscience, which is trying to work on aging. Earlier it was thought that age is not modifiable, but with geroscience, we are already working on this, that we can modify the biological age so as to alleviate the age-related diseases, dysfunction, and longevity. So now it aims to prevent the development of those disorders. So the prevention is going to be there at that particular part, and for this, we need an understanding of the biological mechanisms of aging. And we have to identify novel agents for targeting those pathways. And for this particular part, what is happening, that the scientists have been working in the lab to identify the mechanism. They know the pathways where it can work. But when it comes to developing a drug or an intervention for humans clinical trial, it becomes quite difficult. It's very difficult to have a clinical trial for longevity or health span. Most of the studies have been done on nematodes, or the fruit fly has been the one model for this. So they have been done in the animal models. But when you want to translate it for a clinical use, then there have been some barriers, for which now the proof of concept studies or early stage trials are underway. So when we talk of geroscience, we have to look at the 7 important pillars of aging. The age-related changes, mechanism of aging, they involve macromolecular damage, epigenetics, inflammation, adaptation to stress, proteostasis, stem cell and regeneration, and metabolism. So all these have been mentioned as the 7 pillars of aging, and the scientists have been working at various levels to intervene at these particular places. It's like adaptation of stress, there are certain studies going on, epigenetics, inflammation, macromolecular damage, metabolism, proteostasis is an important area, stem cell and regeneration. So these are the areas where they have been working. And for this, the compounds which are being used and are being prepared, they are called geroprotectors. These are the geroprotectors which would protect us from the aging. So there are hundreds of them. So when you look at these publications related with the anti-aging mechanism, you find there has been a sudden spurt in the number of publications. And since the geroscience started in 2005, but in last 3-4 years, there have been number of publications in this field, and there have been various studies about it. The pharmacological interventions, they have been working on these areas like prevention of oxidation, proteostasis, etc. So since there are several mechanisms of aging, because aging is not one single mechanism, so the interventions are also multiple. We have seen that certain diets, as was mentioned today by Dr. Ansari also during his talk, that there are certain blue zones where the diet has been responsible for a longevity. So these diets have been shown to have reduction in the chronic diseases, and calorie restriction has come up as another way for prolonging the longevity. And there are several types of diets which have been promoted for calorie restriction. Along with this, there are certain pharmaceutical interventions are also being prepared which will mimic the calorie restriction. So besides this, today morning we heard about metformin, which is also being tried, but there are certain concerns about the use of metformin also. But okay, those trials are underway. They will give us the answer. Besides metformin, there are several other agents, drugs, which have been repurposed for the purpose of anti-aging, like simple minocycline, doxycycline, dapagliflozin, or there are several of them. The number has been increasing every day. And there are nutraceuticals. These are the compounds which are found in the normal food items. Particularly, you must have heard about the red wine, which is useful. It's because of resveratrol, which is one agent which has the effect on the anti-aging, on the aging mechanisms as such. Similarly, omega-3 fatty acids, and there are other NAD plus boosting agents, several others, including where curcumin is being tried for this particular purpose. Herbal medicines have claims for anti-aging effect. There have been a systematic review recently published in 2023 itself only, which showed that they have been effective in certain ways to affect the aging effects. But again, they have mentioned that they need to be studied further for their appropriate prescription. One more thing which has been shown to have impact on the aging is gut microbiome. and it has been seen that it does change the immune functions of the individual and disease susceptibility. So that is another area where the interventions are being looked into. We found that the social, demographic and psychological factors have an intense function on the aging of an individual. It has been shown in one of the studies that the 80% of anti-aging effect is because of your emotions, your happiness, and rest is others. So these mechanisms, they also have their way of affecting the aging mechanism through their work on the... So dear friends, I'd just like to conclude. It has been our goal to have healthy longevity, and with the establishment and improvement of public health system, our life expectancy has increased, but it also faces the challenge of increasing number of aging-related diseases. Our aging can be delayed with genetic, dietary, and pharmacological approaches. Geroscience research on aging-related disease has also become a major focus of scientific research and public health system. And there are new methods, new research drugs, new treatments are emerging. And establishing and using new methodologies such as genomics, proteomics, metabolomics, single-cell transcription, and artificial intelligence applications can directly target aging and aging-related diseases to study mechanisms and explore prevention and treatment methods. However, the emphasis on lifestyle modifications, including diet, physical activity, smoking cessation, stress and weight management, has to continue. Thank you. Thank you very much.
Thank you very much, sir. Thank you very much for your nice talk. Please have a seat.